Hello, everyone. Happy Monday. My name is Shalaya Yazdi. I'm a public health practitioner and an osteopathic medical student at Touro, University of California. I'm passionate about raising awareness about chronic condition prevention, management, and treatment. My mentor, Dr. Jay Shubrick, and I created this webinar series to share wellness tools with our community. Dr. Tyree Winters, also known as Dr. Ty Hip Hop Dance Doc, has joined us today to discuss factors that contribute to childhood obesity, how we can address these factors, and how we can start a safe and constructive dialogue with children. All webinars are recorded and posted on our website at tu.edu/mobex/zoom into wellness. Thank you so much for joining us today.
Thank you for having me. I definitely appreciate it.
We're so excited, and Shalaya, thank you again for the great introduction. And Dr. Tyree, I'm excited to have the chance to chat with you again. Just tell us a little bit about your journey. This is a community-facing audience, but how did you get focused on this topic in your practice?
Yeah, so a little bit about me. I'm originally from Detroit, Michigan, and I have always been a person who had to struggle with their weight. I come from a middle-class background, college-educated parents, and so I didn't necessarily come from the quote unquote inner city or from a lower socioeconomic status. However, I still struggled with being able to maintain a healthy weight. I can't say I've ever recalled being at a weight that was considered to be a normal BMI. This is something that led to me developing type 2 diabetes earlier on in life when I turned 16 years old. My family has an extensive history of chronic illnesses such as diabetes, hypertension, high cholesterol levels, early cardiac disease. So this was something that I knew about, and it was something that I really wanted to break the generational curse. And it was something that my family definitely wanted to as well. And I had a supportive family who recognized, even as I was earlier on diagnosed, that, this is something that can definitely be treatable. This is something that you can work towards to prevent some of the long-term lasting effects that can occur from obesity as well as from type 2 diabetes. And so this also spurred my interest even more into going into primary care and going into more of preventative health. So during my time at medical school at Ohio University Heritage College of Osteopathic Medicine, I was able to have a similar mentor in Dr. Jay Shubrick, and got a chance to really start to learn more about what it looks like to be an osteopathic physician who focused in on preventative health. And so during that time period, I was able to go on to residency at Nationwide Children's Hospital in Columbus, Ohio. And at that specific institution, I was able to have additional training in pediatric weight management. And from that standpoint, I was able to tailor my career to focus in not only on pediatrics, but specifically on preventative pediatric care and focus on weight management. And so that's how I arrived at my current destination as a career.
Wow. Thank you for sharing your story, because I know that this has always been something you've worked on as a professional. But it is an important reminder. It's also something you've worked on personally as well.
Correct.
Thank you for being willing to share that. We hear so much about excessive weight in adults, but I don't think we hear as much about children. What's the data show? Is this a problem in children? What are we looking at?
So it is a problem. And just similar to how what we know right now is the prime time known for our media with COVID has exposed a lot of disparities among our nation's population. And obesity has always shown that disparities. Unfortunately, it just didn't get the amount of publicity that it should have received. So we do know that obesity rates in pediatric population has increased steadily. This has been something that we've noticed as earlier on in terms of the 2000s. And what we've also noticed is typically when you think about pediatric obesity, we tend to think about children in groups, whether that is more of the toddler range between 2 to 5 years of age, the school age, early school age children between 6 to roughly 10 years of age, and then for our late childhood adolescents between 10 to 17. So typically, obesity rates were usually elevated at the late childhood adolescent stage. Why this was something that we noticed and was important is because if you look at the probability of that child or adolescent becoming an adult who also suffered from obesity, you saw that it was the probability rates as high as 60% of children who were to be diagnosed with obesity at that age also being diagnosed with obesity as an adult and suffering from not only obesity, but its comorbid conditions. Within the 2000s, we started seeing that age range, even from the early childhood at 6 to 10, also started to increase. And then most recently, as of around like the 2010s, we started seeing a trend of 2 to 5 year olds having an increased incidence of obesity that is alarming, because as we were talking about with as I was talking about with the probabilities of the late childhood and adolescence, we're also seeing that 2 to 5 years of age, that the probability of those children also developing obesity, it increases to 20, 30, sometimes upwards of 40%, depending on the group that you're speaking about. But we also know that this is an age that we can definitely start to target and making more of a concerted effort to limit that range. So that's why we are definitely seeing it. And when I talked about even thinking about where we can see disparities in place for our Hispanic and non-Hispanic Blacks within this country, as well as our Indigenous people, Native Americans, we are seeing that even if you have obesity rates that is, or obesity within the same population you control for socioeconomic status, you control for education, you will still see that the probability of that group still having higher rates of obesity as well as comorbid conditions are increased, even though we have control for those other factors.
So it's a big problem, and it sounds like it's become a bigger problem because it's affecting younger children earlier in their lifetime. And again, the earlier, the more likely it's going to predict that's the next phase you're still going to be there.
Exactly.
Wow. So I don't know that we have an answer for this, but like, what do we predict? Why is this occurring? And again, there are many layers, but I do think this is a national climb. All right, what can we point to as some of the contributing factors?
So it's quite interesting. There are so many different theories, so much research that has gone into this. Some of the big barriers and things that we're seeing is, number one, there has been a significant shift in the way that we are living our lives, whether that is the increased use of screens, so i.e. even Zoom, and this is pre-pandemic. Even if you're thinking about the fact that we still have swaths of populations that have still increasing, or there has been a very distinctive increase in the amount of wealth gap between different groups. So that limits the availability of things such as access to food, access to safe environments to play, do physical activity. Global change have also been named in this, whether or not now we're seeing more and more erratic changes in our weather that we can't predict. Typically, we knew that around starting April to maybe around the beginning of October, you were still able to go outside and play, but those things have changed because of extreme weather conditions. like in California, our fires, et cetera. So these are so many different factors. But besides thinking about all of the other factors, the main thing that we know has been a cause of it is the fact that we have less access to fresh fruits and vegetables, more access to highly processed foods or foods that contain different components, different macronutrients such as trans fats, carbohydrates, et cetera, that has increased the the caloric intake, has increased different ways of composition for the foods that have led to not only children, but also adults not being able to utilize the energy that they're taking in adequately.
Yeah, so it's back to many of the same challenges that adults have, but really some that are unique because children, of course, are reliant on the environment they're in and what they have access to, and they don't have mobility like others do.
Of course, exactly.
Thank you so much for sharing, Dr. Winters. Based off of what we just discussed and what we just learned, what is the danger in childhood obesity?
So the danger in childhood obesity is not only the fact of having a probability of having obesity as an adult, but also we have to think about the comorbid conditions that are associated with it. So we love studies as physicians, as public health experts. This is what we do. We just need it in our lives. And when you look at the studies, it will show that if you have elevated BMI, your probability of having comorbid conditions such as high cholesterol, hypertension or high blood pressure, diabetes, or even what we call metabolic syndrome, where it's different processes that go about with this, you have a higher prevalence of. These conditions we have not seen before in younger children. We know that the longer that you do have these conditions, the more likely that you will have more in lack of a better phrase, side effects that can occur about it. It can affect the heart, the kidneys, the lungs, the brain, etc. And so seeing younger children with these conditions that we typically would have seen in 50, 60, 70-year-olds, we are now seeing the effects of having these conditions for 30, 40, 50 plus years. I shared with you earlier on that I was a type 2 diabetic at the age of 16. I'm currently 42. That means that this is now my 27th year of being a diabetic. And even though I've been able to maintain a hemoglobin A1C that has been below 7 for 10 years and below 6 for more than 7 years, it has been, so that means my average blood glucose level has been within a range of 100, 110. I still know that there is a probability that I can face different issues and challenges that come about because I've had this condition for so long. And being one of those children, and you think about it, 16, late adolescent child who has dealt with this, I know that even at 42, there are things that I have to consider and think about that my counterparts who have been diagnosed with diabetes or other chronic conditions when they were 40 or 50, I would not have the same type of, when it comes down to a different anatomy and different ways that conditions, I will relate to conditions that they may have.
Yeah, and I guess I want to highlight one thing here because you've shared some really important information. Absolutely, the earlier you're diagnosed with diabetes, the more significant that problem is. But to you and looking at you and knowing that you're thriving and knowing all the stuff you're doing, I would also say to the 16-year-olds out there, just because you're diagnosed with diabetes doesn't mean it has to be, you know, a death sentence or that you can't do something about it. But like you got to do something about it right away.
Mm-hmm. I agree wholeheartedly.
Yeah, I think you are a success story, not a, you know, I think you really live to let people know that there's a lot that can be done.
And I appreciate it. And that's that's one of the motivations that I have, and one of the things that I have conversations with my patients about in terms of motivation, because just as I said before, yes, I do know that those probabilities exist, but just the same way as there's other probabilities that occur, it's a possibility. It doesn't mean it is inevitable. And the fact of being able to say, and Dr. Schubert to be a diabetologist and understand diabetes in such extreme high level, he can tell you that to be 27 years out and to still have a hemoglobin A1C of 5.2, that's not typically common. So you can do this. And that's one of the things and one of my motivations and drives, not only for myself, but also for my patients, to share with them that we can do this.
Thank you. Awesome.
Very inspiring and very empowering. Thank you so much for sharing your story. I did have some additional questions for you about any like how do we know if children's weight are not within the healthy range, and how can we address that? What can we do about that?
Sure. So one of the things that I always address and talk about with this is we cannot go based off of our visual assessment. So we can't look at somebody and say like, oh, you're healthy weight, or oh, you're not unhealthy weight. And the reason why I preference that is because, number one, if you think about it, 20% of children in this entire country are considered to be or diagnosed with obesity. 20%, 1 out of 5. So when you look at certain populations, I'm in the state of New Jersey right now. So in New Jersey, for instance, in a city large like Newark, New Jersey, which is the largest city in the state, or even Trenton, the state's capital, that prevalence of children who are considered to either be overweight or obese becomes 1 in 2, 50%, or close to 50%. So can you imagine 1 out of 2 children? You can't look at a child and be able to say like, oh, that child looks obese. And that's sometimes a barrier, especially for a primary care provider like myself, to be even having this conversation, because parents will normally say, my child appears normal, appears like any other child. Well, when 1 out of 2 children technically are considered to be diagnosed with obesity or overweight, that lends to being able to discredit your visual assessment. And it's just not our patients, right? There was even studies that were done that shows for providers, for medical students, for physicians, nurses, even some of our athletic trainers, when they were put to the test, they also saw that their visual assessment couldn't be used. They couldn't just take a look at somebody. So the best way to be able to determine whether or not your child has what we consider normal or abnormal body mass index is to follow up with your healthcare provider. They can then be able to tell you, based off of your weight and your height, to be able to calculate what is the body mass index. The body mass index is the way that we use to be able to give the diagnosis of obesity or overweight. The interesting part about this is that because we use weight and height does not mean that that number is what defines you. So I don't want parents or children to get stuck on a specific number, because remember I said both weight and height. As a child, anyone from males typically and females who usually stop around like 16 to 18 males, and sometimes can even go up to 20 in terms of growing height, you can see as you gain height, you will gain weight. And we don't want a child to stay the same weight or technically to lose weight. We like you to maintain a certain weight as you grow. So it's so important to partner with your healthcare provider, because if we try to do this on our own, we may get in the habit of saying like, oh my God, they gained 3 pounds. Well, they also grew 1/4 of an inch in height. So they're supposed to gain 3 pounds. So that's why it's so important to partner with the healthcare provider.
Thank you, Dr. Winters. And say a child is at a range that is at overweight or obese according to the BMI scale. How can we start a safe conversation that's constructive with children?
That's a great question, and something that a lot of people struggle with, because number one, we do know that when we talk about weight, weight is just not, using the terms obese or overweight has been interchanged not only as a medical diagnosis, but also as an adjective to describe the way somebody looks. And in science, especially in medicine, we talk about things such as called phenotype versus genotype. So when we're thinking about phenotype, we're thinking about the way that we see things, the way they appear, versus genotype, more so the actual matter of it. What I normally say is to start off with the conversation, not discussing necessarily the number or the weight, but to be able to start having a conversation about healthy living. And what does that mean for not only the child, but for the family, for the healthcare provider, and having a conversation that's encompassing all. Now, understandably, there are, when we start talking about children who are in the toddler range, between the 2 to 5 year olds, there is a certain set of maturity that needs to have. And we tailor our conversations to that, the same way that we tailor our conversations to stranger danger, to the way that we talk about brushing our teeth or, getting good night's sleep, right? We just can't go on and talk about more higher knowledgeable things that we just want to make sure that we're checking on the maturity. But even with that being said, it's still important to have that conversation, even when we're talking about the 2 to 5 year olds. And what does that mean about healthier lifestyle and healthier diets? As we start to have that conversation, we talk about how we can achieve that. We also talk about what are barriers that not only the family have identified as being a cause of being able to not have the healthiest diet that they may have, even myself. So when we talk about this, no one is perfect. There are still things that I have to work on to this day. For disclosure, I had 2 non-sugar Klondike bars when I was supposed to have one today for lunch. But with that being said, being able to make sure that I'm thinking about ways of being healthy. I knew I was supposed to have that one Klondike bar, but not beating myself in the head about it. So once we start to talk about having healthier lifestyles, then we can talk about barriers and how we can overcome those barriers. Weight, we do talk about as a way of being able to just kind of identify like, hey, we may be at a point that we need to be either a little bit more aggressive, or we may need to think about it more seriously, but it doesn't mean that this is something that we use as our goalposts of telling us if we are successful or not. We use the way that we change our lifestyle as being a way to tell if we're successful or not.
Wow, those are really, really important points. And I'm going to flip that question over because we have a lot of people in the audience that are watching. And healthcare providers cannot always be the most useful resources. And so for the families there, if they're worried about their kid, how would you recommend that they start the conversation with their provider if their provider hasn't already started it? Because I do feel there's a lot of families that would like information and they may not be getting it from their healthcare providers. So any suggestions on how to do that side of the coin?
That's a great question. And I love the fact that as both of us as all 3 of us being healthcare providers, we recognize and understand that we're not the be all it all, right? We have our own flaws. We sometimes are preoccupied with other different issues that may be at hand and may not be able to address families' concern. And so one of the things that I like to suggest is the internet can be your enemy, it can be your friend, but in this type of situation, I love the resources that are available. There are certain websites that I really, really love and try to use. One of those is the Let's Move campaign that was done by former First Lady Michelle Obama, the Queen. She has a great website that's available for that. There's other also great websites as well. The Association of Pediatric Program Directors, we have Kids Health link that's available that actually have really great resources. But one other component, one other thought process that I would think about this is starting to have the conversation at home and amongst yourselves. So before you even try to incorporate the healthcare provider, actually just kind of doing a self check-in, a self-reflection of how do you feel your home environment is. And sometimes that's just simple as writing down a list. If you're a writer, if you're not a writer, like I'm just not a big writer in terms of what list I have, I'm more of a kinesthetic or a touch and feel person. I literally just go in and I say, go into and get this, your cabinet, if you have a cabinet, or your pantry, if you have a pantry, pull out all of the non-perishable items that you have and just take a look at the nutritional facts. Now, the nutritional facts are based off of a standardized person. Usually it's more of an adult male that weighs a certain weight when we look at what the standard facts is. But just add up how much you would think of with a meal using some of those non-perishables, and look and see in those nutritional facts how much a serving size is, how much you typically would serve. Don't cheat on this at all. Just really be honest with yourself and take a look and see if you are superseding some of those nutritional factors. And it doesn't matter if it's the sodium content, it doesn't matter if it's the protein, fiber, whatever have you, because all of those things you may or may not understand what they mean. If some things are healthy, some things are not healthy, but just writing that out and down and see. That gives you a better perspective of, looking at my diet, looking at what we typically would have for dinner, is this something that we may need to change upon? And as we're thinking about things to change upon, that's one of those things where you can also reach out to be able to seek guidance. There are tons and tons of websites that give you a quick 5-minute breakdown of looking at nutritional facts to help to explain to things, the things that we want to see increased, things that we want to see decreased. And that can kind of help guide you to start making incremental changes even right now while you're waiting to see a healthcare provider or before you want to see a healthcare provider. But those are things that I usually suggest.
Yeah, really fabulous suggestions. And I hope it's very clear to the audience that you are not only an expert in pediatrics, but you're an expert in healthy weight and growth, and in diversity and inclusion. And so in many respects, you are the expert in this area. And so I'd love to hear if you were king or president for the day, what works and what would you suggest that you would, and this is again, a community facing audience. What do you encourage them to get involved in?
So the first thing that I really would encourage if I was king for the day and just being able to say like what I want you to engage in, it's really being able to change your community and being able to make an impact in your community. And what I mean by that is thinking about your community, not only in regards to the people, in regards to the physical space that you're occupying, but also being able to engage the partnerships within your community as well. Those partnerships include grocery stores, it includes whether that is the local gym that may or may not be in your neighborhood, whether that's a gym like LA Fitness, or if it's a gym like the YMCA, YWCA, Boys and Girls Club, but also thinking about the green space that you have in your community, the walkability of your community, because that's huge. You'll be surprised at how many neighborhoods don't have great sidewalks or great access just to walk around in. And so those are things that I would really, really want to change and have people be able to make suggestions that will be meaningful and that will be heard and act upon. Because especially thinking about diversity, equity, and inclusion, using that one point of inclusion or inclusivity. We are so different, and there's no one that is homogenous, right? There's no one man or no one woman or no one Black person or no one Latinx person that is the same. We all have different interests and different varying points and goals. And these are things that are important because we make up one whole country, one whole community. And so being able to include all of those different points of views, being able to find our similarities and also being able to appreciate our differences and figuring out how do we use both to be able to create an environment and a community that is encompassing for all and being able to work for all. That would be my ultimate goal, my aim.
Yeah, and one of the things I heard you say, and thank you so much for sharing the dream, because I love it, is that taking some control of your environment. And we had an earlier speaker that talked about women in their neighborhood that didn't feel safe, but they went as a group, and
Yes.
and the neighborhood became safer because they were women who were leaders in the neighborhood, and they would communicate if there were young people maybe not acting appropriately. And so they took back their neighborhood. And again, I know that that's not possible for everyone, but it is certainly an example of people saying, this is my space and I'm going to make my space okay.
And speaking in that same vein, being able to create community gardening, right? So even if you have never been a gardener before, don't even have space. If you live in an apartment maybe, or you live in a trailer home or any specific space, a yurt, for instance, because I know in California, there's tons of yurts. I love that idea, by the way. Being able to even grab something such as, if available, a pot that you will plant something like thyme or something like even strawberries or something along those lines, that you can start to grow your own produce. And if you incorporate other neighbors or friends or family or whoever to be able to create the same thing, you create this community garden where you're growing organic fruits and vegetables that you can be able to share amongst each other, and being able to create recipes and even think about, I'm going lofty on this one, but like community dinners where you all sit outside, especially since it's COVID, and being able to share meals where you're using fresh fruits and vegetables. And it's something about utilizing the fruits and vegetables that you grow. My grandfather was a farmer, he owned a farm. I don't know why, it just tastes so much better.
It always tastes better.
Yeah.
It sure does. Yeah, and for those that don't know, I know, of course, we're spanning the country here. Vallejo People's Garden had a celebration last night. So we actually have a community garden in our city that had an event last night, and I guess there were a lot of people. So yes, it is possible. So thank you.
Love it.
Yeah.
That's wonderful. Something I'm really excited to learn more about is your nickname. We have Dr. Ty Hip Hop Dance Doc. Can you tell us more, please?
Sure. So one of the things that I love to do is dance. And when I was in college, I pledged my fraternity. And for those of you who may not know, historically, Black fraternities and sororities, we do something called stepping. And stepping is a dance form that was originally developed from our roots in Western and South Africa, and was brought over during the slave trade and continued on amongst its descendants. And so when I was doing stepping, one of the things I always noticed is we did step practice, or if I was dancing, I went to a party and danced, it always helped with me just dropping weight. It just was always a really great way of maintaining my weight. And so I was able to continue on and take a couple of dance classes during my time in residency, and then also as I stayed on as an attending at Nationwide Children's. So I was at that time now a pediatric weight management specialist, seeing patients and hearing over and over and over again how many barriers that existed for my patients to not be able to do physical activity. And one of my suggestions was always like, you can always turn on a radio or you use your phone, iTunes, if you had iTunes, whatever have you, YouTube, being able to turn on music and just dance in your room. Or whatever space that you had. It doesn't usually have to take up that much space, and it can create a moderate level of physical activity to do. So I got an idea where I said, you know what, I can utilize the waiting room for my clinic and be able to host a dance class. I felt like I could probably teach a dance class to my patients. And it was also a twofold approach because I used it to be able to help to be an incentive for my patients and families to come back. For those of you who don't know, weight management, you can sometimes have a lot of patients that don't show up to the appointment. So we can have what we call a high no-show rate. So a way to be able to encourage folks to come back was say, hey, if you come to these weight management appointments, you can also participate in this free dance class that was done. So set the scene. 2014, I'm like, okay, I'm going to do this. I went to my boss and said, hey, can I utilize the waiting room at the clinic after hours on a Friday? And so she said, sure, why not? Go for it. I purchased the speaker on my own, created dance steps, borrowed some dance steps from my dance teacher with her permission, and said, okay, I'm going to make a flyer, invite people to come out. We had 30 people come out that first time, and we did an hour dance. And the one thing that really resonated with me was that the patients and the families were so impressed that their doctor was doing this with them. And like I explained to them, like, you know, I'm not this mythical person that tells you to do all these things, and I don't do them myself. And I really wanted my patients to see that, you know, I'm sweating, I'm breathing heavy. I'm not the best dancer in the world by any stretch of the imagination, but I'm doing this and we're doing it together. And so that really started to just balloon. And as it ballooned up, and I was able to partner with the YMCA. I also had the privilege of, with the American Osteopathic Association, being named as one of the national spokespersons. During that process, one of the things that you go through is training on how to be a spokesperson. And so they asked for different factoids about you and things that would be interesting. And I just in passing said I taught a dance class. This was not meant to be anything that was supposed to be out there. I wasn't trying to be, this is even before TikTok, obviously, but I wasn't trying to be TikTok or YouTube famous or anything along those lines. And the AOA said, oh my God, you have to do this at our national conference, which we call OMED. And so in Philadelphia in 2017, I was able to host a dance class in the middle of our exhibit hall where everyone typically comes in. And it was in the middle of the busy time of the exhibit hall. And I wanted to make a lasting impression. So I told them to turn the music up. I found the song that was the most hip-hop-ish song that I could think of that still would have been something that a lot of people knew. So I chose a song that was by artists Drake and Rick Ross and Lil Wayne and all these people that I was like, I really want this to just blow up. And we just started dancing. And the next thing I know, I looked around and everyone in the exhibit hall was dancing and was participating and had a great time. It was shared on YouTube and it got over 30,000 likes on YouTube. And from that point on, I started getting requests for interviews, and it turned into this explosion that I couldn't even control. And I seized the moment and said, I'm going to use this to be able to reach out to as many people as I can to be able to promote healthy living by using dance. And to this day, I actually just recently started, it's in the works now, but a training program to be able to train youth on how to be able to teach hip hop dance and being able to provide preventative health counseling. So that this is how it all came about.
That is just amazing. I love that story, and I only know part of it, so I know the rest of the story now. So, so that's something I think that, the beauty in this is that we all can be with family. We can all be in a space, and for many families, that movement is something that's very familiar.
Mm-hmm.
And so, this is where this is not only good for the kid in question, this is good for the whole family. And this is something we could do together. This is something we could be safe, and it's something that really unites us. And then what you've done is back to talking about your community. You brought your community together, so that bigger family to say, and whether that's at a conference or that's in your waiting room, you now have a larger family being healthy together, which is, of course, why we're so glad that you're here.
I appreciate it, and it's amazing how many, and I love seeing, and I know a lot of people, there are more physicians that are out there that are dancing. It's such a community that's out there now, and I applaud every single one that's out there that is using this as a vehicle to be able to promote health. And I think the beauty about it is that the kids, and what was meant to be for the program, is for them to be able to take back these routines and be able to utilize them at home. So even in cases of that it's too dark or not safe to go outside, or there is no other means to be able to do physical activity, they can always have a built-in type of program that they can do, even if it's for 30 minutes that they know about, 15 minutes to be able to continue on with their physical activity. And they can share this with their family. And it has proven to be something that has continued to live on, even in Ohio, after I have moved away 5 years later.
Wow. Well, we would thank you so much for being with us today. And I do want to make sure that if you could leave 3 nuggets for our audience, what are 3 things that you would say they can do to take the health for their family, take charge of their health, take charge of their health for their kids?
Sure. So 3 things that I would want them to do. So the first thing that I would want them to do is to know that they can do this and to be able to make sure that they feel empowered. So I want them to leave with empowerment, knowing like this is not something that is beyond their means. And every little small incremental step makes a huge difference. Even if it's for a 5 minutes, I'm going to do jumping jacks for 5 minutes or whatever have you. That small step is like that small, tiny drip that keeps hitting the stone that will chip away at the stone. So that's the first step, is empowerment. The second step that I want to leave with them is being able to understand that there are so many people that are in your corner, and being able to make sure that they are creating a community, not only for when we hear people talk about like, oh, I need a accountability partner. I don't want you to think of somebody as being an accountability partner, because accountability partner typically means that it's somebody who is going to pick at you and nag at you. But I want somebody who's going to be your encourager, your nurturer, someone who's going to support you in good times and support you in the bad times as well, and being able to keep you encouraged and not necessarily point out when you're doing things wrong, but to be able to point out when you're doing things correct. And the last thing that I want to leave people with, or tell people to have, is mercy. Mercy on yourself, mercy on others. Understanding you are going to make mistakes. You saw, I didn't sit here and cry and boo-hoo or beat myself down because I said, I had 2 Klondike bars instead of 1. I realized, like, you know what? Hey, today was one of those days where I wanted a Klondike bar. Now, maybe tomorrow I may say, like, you know what, you had 2 Klondike bars, so maybe you don't need to have a Klondike bar tomorrow. Probably won't happen. But still, with that being said, you want to make sure that you have a mercy on yourself. And sometimes you need a break. And if that means that, you know what, I just need to take a break from this. I've been going hard at it and I just feel like I'm burning myself out. We don't want you to get to that point that you burn yourself out. It's better to take a break and recognize and say, like, you know what? Hey, it's Thanksgiving. Hey, it's Halloween. Hey, it's this or that. Food is not your enemy. Exercise is not your enemy. It's really meant to be enjoyed. And if you start to develop a negative relationship with it, I can guarantee you will avoid it, or it will become something that will be your enemy and not your friend. Food should be enjoyed. It should be something that it brings families together. We have holidays around food. Have a healthy relationship with food. So have mercy on yourself, not take yourself too seriously, stay empowered, and also make sure that you have a community that's encouraging and nurturing.
I love that. Yeah, and I just want to really emphasize that. So take a first step, whatever that step is, I heard you say. Surround yourself with people who support you, not people who put you down, because you don't have to do this alone.
Exactly.
And then have mercy on yourself, just like you would have mercy on others, and just know that this is an ongoing process and we're going to be human. And then have a healthy relationship with food because it is your nourishment.
Exactly. You hit the nail on the head.
Well, you hit the nail on the head. I summarized it. Dr. Winters, it's been an absolute pleasure having you today. I'm so glad to have the opportunity to chat with you. It sounds like you're just doing amazing things, and we're so grateful for the time and the expertise you shared with us this evening.
Well, thank you so much again for inviting me. Thank you so much, Shalala. It was such a pleasure to speak with you and to speak with the audience. And I just really hope that everyone stays encouraged. And please, by all means, always, I'm on Facebook as well as on Instagram for Dr. Ty Hip Hop Doc. So you can always follow me. And hopefully, we can dance together at some point.
I love it. Thank you.
Thank you so much, Dr. Shubrook, and thank you, Dr. Winters, for taking your time to be here today. This was a very informative and empowering conversation, and we thank all of our audience members for watching. And we look forward to the future of having Zoom into Wellness with other webinars coming up, like health equity and health literacy, diversity. So just stay tuned for that and visit our website at tu.edu/mobec/Zoom into Wellness. Thank you all. Bye.